All right, and I want to welcome everyone to the next installment of our bowel care series. I'm here with Beth Householder, and we're going to talk today about incontinence and skin integrity. Beth, how are you today?
I'm doing great. How are you, Scott? Thanks for having me on your series. I appreciate that.
No, this is our series. No, and we want to thank obviously Enemies for their support of the program and want to welcome everyone from the Thrive community. This is information that could get a little uncomfortable from time to time, but it's always good, as we say, to push our comfort zone and to educate and learn more. So today, let's dive into it. Tell us what we have to be on the lookout for with regards to incontinence and skin integrity.
We really want to make sure our skin stays dry and free from infection and things like that. So it's really being very careful in the management of your skin. So let me just set up my screen so you guys can see this a little better. 1 second here. I apologize for the delay. All right. Is that looking better, Scott?
It looks phenomenal.
Okay. All right. Well, so we wanted to jump in and really talk about how, like, the area of the coccyx, we have to be extra vigilant to protect. There's many factors that can lead to pressure injuries. If pressure injuries are really sustained from any, and people are at highest risk if they really can't change position without help themselves. But there are many extrinsic factors or primary factors, as well as intrinsic or secondary factors, which you can see here are listed as age, comorbidity, nutrition is vital, skin integrity, and then if you note here the picture of the image of the woman, you can see often these are 5 trigger points where often you might see pressure injuries develop. But just note, Scott, that the extrinsic or primary factors that are most destructive for the skin are moisture, pressure, shear forces, and friction. And shear forces, just to explain that a little better, is when gravity pulls the patient downward and the skin stays in place. So we directly work with hospital systems that they don't sit the patient up, especially if they're rehabbing, too high in their bed because they may slide down and tear the skin. As well, that friction when the skin and the surface, of course, interact, and they can cause abrasion or ulceration. So we really want to make sure that blood supply is not cut off from these areas, because pressure injury occurs where the bone or the hard surface, like the bone meets the bed, I like to say. But a key factor in this is caring for your bowels as well as caring for the skin. So let's dive in today. We've talked about bowel care in the past. Let's dive in a little more, Scott, with the skin and understanding as we age, our skin ages too. Skin becomes thinner and atrophies, especially the epithelial and fatty layers. Additionally, collagen and elastin starts to shrink and degenerate, all these fun things. And fibroblasts, those cells that typically help skin recover, they cease replicating. You often hear women buying those skin serums to help speed up the recovery of their skin cells. It's true, as we age, these stop replicating. And then all of this results in thinner, drier, and less elastic skin that heals more slowly. And that's the real message. One other important fact, Scott, is that once you've had a pressure injury and you've damaged the skin to some extent, it never fully is as strong or resilient as it once was. We only get about 80% of our skin integrity back once we've sustained a pressure injury. So I don't know if you knew that.
We really need to protect it. I mean, we notice that all over our bodies, but when we've had damage to the skin and there's areas where there could be repeated damage, whether it's a bone sticks out more, or again, it's just really that weight bearing, whatever part of your body. I know we always think about the bottom as like, I have to worry about sores when I'm sitting, and that's carrying a lot of the weight, but anywhere in your body where there's constant pressure. So I love that other photo too. But these I know a little bit graphic and everything, but I really think it's important, Beth, that people realize, you know what, if this what it takes to look at, if this is what it takes to look at, to have you say, hey, you know what, I need to reposition more, or I need to do more weight shifts, or I need less moisture, or whatever it may be, to certain areas, then, you know, have this image in your mind and say, I never want to be there ever, or I never want to be there again if this has happened to you already.
Absolutely. And I think you mentioned in the past, maybe the idea of taking a mirror and looking at yourself in the morning and maybe before bed to check for these sores and these skin irritations throughout the body.
Yeah, Beth, yeah, we ever, and again, unless things have changed, I know it's been forever since 1986 when I was in rehab, but everybody was given one of these mirrors that had a long like cord and it was bent on it, so you can turn it in every angle and basically, as a paraplegic, see every part of your body. But quadriplegics, that's where again the vigilance comes in, and you have to share with your caretaker and everything. Hey, did you check all these parts of my skin and everything? Because you never, ever, and I know we all have busy schedules, you never want to take your skin for granted and just say, you know what, I don't have the time. It's fine. I was sitting on a cushion all day. You never want to take anything for granted, because that's all it takes is one moment of neglect that could hospitalize you. And again, not to scare you, but you could develop something here in which it could really compromise your life on many levels.
It's true. And pressure injuries are preventable, but once it starts to happen and you feel that, there's that warm, the skin starts to get hard. And if your caregiver or yourself touches it and doesn't return to natural color in 10 to 30 minutes, that's an early sign of a pressure injury. And we need to act fast so it doesn't progress rapidly from stage 1 to stage 4, because it really can, and it can lead to septicemia, infection, and really dire consequences. But just to compare and contrast here, I'm sorry about these images, but just to show what an IAD or incontinence associated dermatitis looks like. Of course, it's that bright red rash, but it's always from the skin laying in feces or urine. It's always from moisture. So this is preventable. And if you start to see this develop, we need to protect the skin from it breaking down further. And it's really that combination of urine and fecal matter that breaks down the skin more readily than just urine alone. And then on contrast, on the left side, Scott, you see a pressure injury. This, again, always develops where the hard surface and the bone touch. So it could be not just the coccyx, but the tail, the back of the head, the shoulder, the hip bone, your ankles, etc. Anywhere where there's not circulation for 2 to 3 hours, according to Johns Hopkins, that those tissues can start to die. So as you mentioned, we do want to encourage people to even set a timer and just move, make it part of their routine to constantly offload their weight, whether it's shifting left, leaning way forward, as often as possible, make 15, 30 minutes apart to make sure it becomes part of your daily routine.
Beth, we all have one of these phones on us. We all have a mobile device. Every single mobile device that's out there or a computer has some type of an alarm. And we use alarms when we have an important business meeting. We do it for doctor's appointments. If that's what it takes to get you into a habit, I'm not saying you have to do this the rest of your life, but to weight shift, to do something that gives you an idea of having to shift my weight every 15 minutes, that's what it takes. So I'm just like, why run that risk of forgetting to do it? Again, I'm just seeing too many people these days who are relying on technology, meaning cushions that are better than ever before, to reduce the number of weight shifts you have to do. And if you're taking that approach, again, some of these cushions that they have could have a hole in them. And so you don't even know you would be sitting on a cushion that had no more air in it or was distributed incorrectly. So, you know what, just again, set an alarm, have a quick little thing and just do it. But you will get into a habit to the point where you won't need that alarm anymore.
Yeah, absolutely. That's a great suggestion. And then just to show a statistic or two and not belabor the point, but pressure injuries do go hand in hand with morbidity and even mortality. They are something to be very, cautious about because they are very dangerous. In fact, I think you mentioned that it was Christopher Reeve's birthday anniversary today. And he was someone who actually had a pressure injury at the end of his life, and it developed into something more. So we want to prevent something serious from occurring. So let's just dive into some treatment options. Obviously, with pressure injuries do develop, requires a multidisciplined approach with nurses, physicians, and caregivers. Family members as well can all help. But treatment interventions do include a management of conditions that give rise to these pressure injuries, like support services and nutritional support. But protection and promotion of wound healing, I want to focus a little bit on here today, Scott, like wound dressings, topical application, and various adjunctive therapies that are used in addition to standard pressure injury care, such as vacuum assisted closure, ultrasound therapy, electrostimulation, and hyperbaric oxygen therapy. And eventually, if you get to a stage 3 or stage 4 wound, you will need surgical care to debride and clean the wound. And then they often make a skin graft by taking a piece of healthy skin to cover that open wound and close it back up. But topical antimicrobial agents continue to be used widely for the prevention of wound infection. And that's where we just want to introduce a brand new product to you that has been tried and true for women with radiation dermatitis. We've had some great responses about reducing itching and pain, as well as inflammation from dermatitis. This is also a great solution for patients with early stage pressure injuries or ulcers to prevent that infection from spreading. Not only does it have allocaine and vitamin E, Scott, but it also has lidocaine for localized pain relief. So, that might be for an upper body injury, but also it has an antimicrobial,
Right.
which is valuable if the skin has been broken and we want to stop infection from spreading.
Absolutely. That seems like, there's so much, so many of those ingredients there, or so many things I should say that, I mean, the ingredients, but the treatments there,
Yeah.
it's almost like all around. I mean, I saw psoriasis on there. I saw eczema. So you're
Yeah,
talking
maybe.
about like a dryness of the skin. And
Yeah.
then, so you're talking there's moisture ingredients, and then you talk aloe and vitamin E. So I see a lot almost like as preventative, but also in case you do end up having that sore or have something going on where the skin has been compromised. I think this is a great addition to your prescription cabinet. So I think this is great. But you
Yes.
don't need it. You don't need it. Do you need a prescription for that?
No, you
Okay.
do not. You do not. But please, if you're interested in trialing this product, please reach out to me. Take a snapshot of this. Add my email address, and I will ship you to your home or wherever you are some free samples to trial and see how it works for you. But that would be the best thing to get you started. Or if you have any questions about the product or concerns, please reach out to me directly. Appreciate that.
Beth, knowledge is power, and you continue to deliver. So we can't thank you enough. We want to make these short. We want to make these simple. We want to make these to the point. And again, an area of our lives that we absolutely need to be vigilant on. We need to be educated on. And so thank you so much for delivering this message to us tonight.
You're welcome. And I hope you guys come back for more of our Bowel Care series with Scott. We really appreciate your listening and tuning in. Thank you. Have a good night, everybody.